Oh, hello, hello, hello. This is Dr. Latoya Wells. I want to apologize for the tardiness. I am traveling and trying to get online has been a chore. So here we are for Wellness Wednesday with Dr. Latoya Wells. Thank you again so much for joining all of those of you who join us every week. I'm just grateful for each and every one of you. Tonight we will be discussing um, a very interesting topic. As you know, we have been dealing with extreme heat temperatures in the hundreds, feels like 110, 112, 114 in some areas. And so tonight we're going to talk about the skin. And how many of you know that the skin is the largest organ? You have, our body has a lot of different organs. We have our heart, we have our brain, we have our kidneys, we have our lungs, we have our liver, our intestines. For men and women, we have our different organs, but the skin is the largest organ in the human body. And tonight we're going to talk about the skin with the extreme temperatures, and there's been an increase and an uptick in individuals being admitted to the hospital for heat related injuries and illnesses. And we talked about this a couple of weeks ago. But I wanted to highlight the skin because it's so important and it does so much for our bodies that I don't think we really give it credit for, or we don't really think of the impact or the magnitude of what our skin does for us. And so, as it being the largest organ of our body, it protects us from so much. It helps us in so many different ways. And so, we're going to delve into that tonight. Okay, so just a little tidbit. Again, I am Dr. Latoya Wells with Wells Legacy Health and Wellness. I am a family nurse practitioner and I have a doctorate degree in nursing, so that's where the doctor comes from. And I am the owner of Wells Legacy Health and Wellness. Our goal with Wells Legacy Health and Wellness is to help our patients, community, and family and friends create a legacy of good health. And we do that by one, providing education. Another way is by providing advocacy for our community to help you be able to advocate for yourself as a patient. And also by providing healthcare services that we provide at our office. So our outreach is expanding and I'm excited about it. And this is one of the things that is so important to me is education. So tonight we're just going to have a little chit chat about the skin and how it protects us. Our skin protects us from infection. Our skin helps us regulate our temperature, whether it's hot or cold, right? So if you are hot, what do? You sweat. When you're cold, we tend to shiver. And those are all signals that are sent from our brain to our skin and from the skin to the brain to say, hey, it's too hot, let's work on cooling down. Or it's too cold, let's work on heating the body up. It serves as a barrier for infection to protect us from different infection and different environmental factors, chemicals, things of that nature. Our skin is one of the major protecting factors that we have as human beings and those with skin. It prevents moisture loss, and it also helps to protect against UV rays from the sun. So, and I'm sorry for the noise in the background. I'm in a conference room, and so there may be some background noise. I did move from another location so that I can be here that I found was a little quieter. So, with the UV rays, we're going to talk about the importance of sunscreen and covering your skin and all of that. The skin is also a source of senses in terms of sensory, where we can feel different things. We can feel different textures with the skin and the nerve endings on our fingers. We're able to feel different material, whether it's hot or cold, burning, stinging. You're able to feel pain. There's so many nerve endings that are connected to our skin And so, with that being said, our skin is one of the major sensory organs as well that we have as human beings. And again, the biggest things that come to mind is hot or cold, right? If you touch a stove, you know that it's hot. And if you touch something or hold something that's really cold, then you know that it's cold. The first place of impact is our skin. And when I think about hot temperatures right now with the sun and the heat that we've been experiencing here and across the nation, there are so many individuals who are, as we talked about early on, heat strokes and heat exhaustion. We don't really talk about sunburn and damage from the sun to our skin, the increase of melanomas and skin cancers, and changes in the skin because of excess exposure to the sun. And so it is so important that we, one, take care of our skin, right? Making sure you're drinking plenty of water, plenty of fluids, making sure you're wearing the appropriate clothing, as we discussed during our talk on heat related illnesses and injuries, making sure you're wearing the appropriate clothing, making sure you are well hydrated, making sure that you are applying sunscreen. Those are some things that we can do to protect ourselves in terms of how I'm bringing it all back to the extreme temperatures that we've been experiencing lately. As I mentioned previously, we have had an increase of skin issues because of the sun. The sun can, and the extreme temperatures can dry the skin out. And for those individuals who may have already pre-existing skin issues, eczema or sensitivity in different areas, increased temperatures from the sun or increased exposure to the sun can cause those already problematic issues to become worse. And so it's important to know your skin. It's also important that we are paying attention to the color of our skin. If you're fair skinned, you can see redness pretty easy. You can see when you're beginning to burn or potentially having a sunburn develop. Or if there's a rash, you can see that pretty easily. Or if there's changes in the skin color, so different colors of the skin, depending on your skin tone, can signify whether or not there's a health problem. So redness is a sign of irritation or infection. Um, there's changes in the texture of the skin, bumps, bruises, things of that nature. You can see that. Um, Infection shows up in different ways on the skin. Changes in the skin color can also be caused by liver disease or poor circulation or lack of oxygen or not enough red blood cells that are flowing to the skin. And you may see that ashen or dull tint to the skin. So there's so many different things. And that when we think about color and changes in the skin color, how it could tell us by our skin that we have an issue going on. Break down what the skin looks like. You know, we have our skin, we can see it. This top layer is the epidermis, it's the top layer. Underneath the epidermis is the dermis, that's the second layer of the skin. And then you have the hydrodermis, which is the bottom layer of the skin. And many times we don't really focus on that unless we're talking about some type of burn or injury to the skin. But it's important to understand the different layers of the skin, because if someone were to sustain a burn, we classify the burn based on how deep it is and how many layers of the skin have been damaged or exposed. Um, it's important when we are outside that we're wearing sunscreen. And there's different brands of sunscreen. There's different SPFs, which tells us how much protection we will have from the sun. And it's recommended that we use a sunscreen that has a minimum of 30 to 45 SPFs included on there. And spraying sunscreen or applying sunscreen once and you're done is not the way to go. Typically, you're going to be reapplying that sunscreen at least every 15 to 30 minutes while you're out in the sun. Another thing when it comes to your skin and the importance of taking care of your skin, each and every one of us should have a skin check every year as a part of our health exams, our annual health exams. Doing so can give you a baseline of what your skin looks like. And if there's any changes, then you know, okay, there's a mole here that has some atypical changes. We need to make sure we're following that. Okay, so your primary care doctor or your dermatologist can help you with that. If you have a significant other or family member at home and you're doing your own skin checks, you want to make sure you have someone or a mirror to where you can see the back of your back, right? You're looking at the back of your neck, your ears, anywhere you have skin. Your scalp, you want to begin to feel the scalp to see if you feel any abnormal moles or any abnormal growths. Another key importance is to look at the bottom of your feet, in between your toes, in between your fingers, right? um, Under your arms. You're going to do a detailed skin sweep to take a look and see if there's anything that's abnormal. Okay. Women looking at the breast, the genital area for men and women, you want to make sure that you're getting a good look of every surface of your body that has skin. Okay. Um, uh, Somebody just joined. Hello. It is important that we're taking care of our skin because this is our first line of protection. And if this is damaged or injured, then it leaves us open to becoming susceptible to infection, right? So I had a question: when the skin is damaged, what do? We want to take care of it. Depending on the type of injury or damage, the treatment will vary. So we just got to make sure that we're taking care of our skin, that we're doing what we need to do to monitor and know the baseline of your skin. Okay. So let's just recap. The skin is the largest organ on the body. There's different protective measures that our skin offer. It keeps us from getting infections. It's a barrier, right? So it wards off infections. It helps to regulate our temperature. It helps prevent moisture loss. It protects us from UV rays. Things that we can do for the skin: one, making sure that we do our skin checks every year and that you have a baseline and you know what your skin looks like. And if you have those abnormal moles or, just little changes in color, you know what that is because you've done your annual skin sweep or skin check. You're following up with your dermatologist or your primary care provider. And when you're having your annual physical, they are doing that skin sweep for you. If you notice anything that's abnormal, you're going in to get that checked out. Another thing that we can do is one, making sure that we are wearing protective clothing. If you're out in the sun, light clothing that's going to cover you. There are clothes now that provide UV protection. And so many of the sports shirts and things of that nature provide that coverage and protection from the sun and the UV rays. And then applying the sunscreen. Take care of your skin, do what you need to do. And another question that I received is: I am darker skin tone. Do I need to wear sunscreen? Of course you do. We have skin, so our skin is just as important and at risk, just like anybody else who may have a fair skin tone. They just may burn quicker than we do, but we do burn. And if you were to see my shoulders right now, you could see that I have a suntan. I was traveling about a week ago and was out and forgot to bring my sunscreen. I know, shame on me. But you will see the change in the color of those that are darker, and that puts us at risk for developing sunburns. And we are also at risk for developing skin cancers, abnormal changes in the skin because of excessive exposure to the sun. So I'm going to go ahead and wrap up. I'm not going to keep you here long. I come on and say what needs to be said. Make sure that you guys have the knowledge that you need so that you can take care of yourself. Thank you all again. Again, I apologize for the technical difficulties. It was a struggle to try and get on here, but we made it. So this is Dr. Latoya Wells. Stay safe, be well, take care of yourself, and do your skin check. Until next time, stay safe. Take care.